My name is Catherine Patterson, one of CityHealth's co-executive directors. Hopefully in a few minutes, I will be joined by my co-executive director, Katrina Forrest, who will help us walk us through the findings that we have discovered with our recent report, Alcohol Violence and COVID-19, How Cities Can Prevent Violence and Safer Alcohol Sales. Before we get started, I do want to provide some background. For those of you who are new to CityHealth, we're an initiative of the de Beaumont Foundation and Kaiser Permanente. We work directly with cities to advance a package of 9 evidence-based policy solutions that have been proven to result in better health and provide for more vibrant and prosperous communities. One of these policies is safer alcohol sales, which are a set of local policy tools that enable cities to directly address alcohol-related consequences in communities and improve overall community health. I don't think I need to convince anyone on this webinar about the seriousness of alcohol-related harms in the United States. But to be abundantly clear, there is an alcohol problem in America. The facts are startling. According to the CDC, alcohol use in the US contributes to 104,000 deaths per year. Alcohol is a contributing factor in 47% of homicides. It's also the #1 drug used by young people, with more than 3,500 people under 21 dying each year because of alcohol use. While the human impact of alcohol is definitely eye-opening, the economic impact is just as stark. In 2010, the last year for which an estimate is available, alcohol problems cost the United States $249 billion. And the problems that result from alcohol use are only getting worse. The alcohol-specific death rate rose 55% from 2000 to 2016. ER visits involving alcohol consumption rose 62% between 2006 and 2014. And alcohol liver disease, an indicator of excess alcohol use, rose by 37% from 2000 to 2017. Complicating things further, early data show that alcohol problems have been worsening during the COVID-19 pandemic. As lockdown started in March 2020, there was an immediate surge of alcohol sales from outlets like liquor and convenience stores, as cities instituted lockdowns and restaurants and bars closed or reduced their services. In the week ending March 14th, 2020, takeaway sales of wine increased by 27%. Beer sales increased by 26%, and cider and malt beverages increased by 14%. Those numbers were not an anomaly. By June 2020, total alcohol sales were still 21% higher than June 2019. COVID's impact on alcohol use has been significant, and we'll dig into this topic a bit more in the forthcoming panel discussion. CityHealth's safer alcohol sales policy focuses on increasing local control over and input into the practices, placement, and density of off-premise alcohol outlets. Alcohol outlets, for the purposes of this report, are businesses that sell alcohol for on-premise consumption, including restaurants and bars, and for off-premise consumption, like liquor and convenience stores. In many cities, the spacing and placement of alcohol outlets also surfaces and underscores longstanding inequities. Redlining, the US government-backed housing policy and practice that began in the 1930s and continued until the early 1960s, systemically denied people of color access to federally backed mortgages. One of its long-term deleterious effects has been the over-concentration of alcohol outlets in low-income communities and communities of color. Research shows that many redline neighborhoods have a higher proportion of alcohol outlets, with the evidence suggesting that the interaction of redlining with the racial makeup of neighborhoods has the greatest explanatory power for the proliferation of outlets in these communities. As you can see from this residential security or redlining map from 1937, there continue to be stark differences in Baltimore between redline neighborhoods and majority white neighborhoods when it comes to alcohol outlet density. A majority white neighborhood, Roland Park, has a median income of $104,000, and an alcohol outlet density of 2.7 liquor stores per 10,000 outlets. Compare that to Greenmount East, a red line neighborhood in Baltimore with a 97% Black population, which has nearly 3 times as many liquor stores. This is just one of many examples of the inequities that exist in the safer alcohol sales policy arena, and I am eager to hear the panelists discuss alcohol outlet density and equity in greater detail in just a bit. There's also a strong relationship between alcohol outlet density and violent crime. Neighborhoods that have a high density of places that sell or serve alcohol are associated with higher levels of violent crime, even after research accounts for a wide range of other factors. Addressing alcohol outlet density has taken on a new urgency during the COVID-19 pandemic. Police departments have reported increases in domestic violent incidences, and numerous cities are reporting increases in homicides and aggravated assaults. The relationship between alcohol outlet density and violent crime is best illustrated in our map. Let's take a look at the city of Atlanta, which has significant local control over its alcohol outlets through joint local and state licensing powers. In this map on the screen, red indicates areas with high alcohol outlet density. The city of Atlanta has 500 off-premise outlets, or 15 times the number of public libraries, and 16 times the number of public high schools. The black boxes show census tracts with higher crime rates compared to other parts of the city. You'll see that nearly all higher crime boxes are located in areas of high alcohol outlet density, although higher alcohol outlet density does not always coincide with areas of high crime. From 2003 to 2007, Atlanta used their alcohol licensing powers to decrease the availability of alcohol at both on-premise and off-premise outlets in the Buckhead neighborhood by 3%. Studies that examined this municipal experiment have found that overall crime was dropping during this period in neighborhoods across the city. However, Buckhead experienced a decrease in crime that was 2 times greater than the crime decreases in comparable neighborhoods. Baltimore is another example of a city where alcohol outlets far exceed the number of public libraries and high schools. Yet the city of Baltimore has no licensing authority over alcohol outlets. There have been a number of studies conducted in Baltimore, which found a strong relationship between alcohol outlet density and a variety of harms, including violent crime, pedestrian safety, and life expectancy. One study estimated that removing alcohol outlets from residential areas could potentially prevent between 7 and 52 homicides each year, and this saved the city between $8.7 and $65 million. Baltimore's experience is unique, and we'll talk more about the city's approach and challenges with Dr. Barbeau in the upcoming panel. The Atlanta and Baltimore experiences and examples show the importance and impact of safer alcohol sales policies on the health of local communities. Safer alcohol sales policies enable cities to address alcohol-related problems by specifying the number, density, sales, and service practices of alcohol outlets. The evidence shows that these policies can make communities safer by decreasing drinking-related crimes and injuries. Evidence also shows that it can reduce excessive and underage drinking by limiting the availability of alcohol. To date, 8 cities have earned a CityHealth Gold Medal in this policy area, and 8 cities have earned a Silver Medal. CityHealth awards gold medals when a city has taken jurisdiction over all its alcohol outlets. And silver medals are awarded to cities with laws that apply to some, but not all, outlets. So let's talk a little bit about what cities can do. The primary tools cities have to regulate outlets include licensing authority, zoning, and nuisance powers. Cities that have local licensing authority can limit alcohol density by limiting, suspending, revoking, or denying licenses or other permissions for outlets to operate. By using zoning powers, cities can determine a wide range of service practices and activities in or near alcohol outlets. and deny and can potentially deny the use of outlets to use these land and effectively shut them down. Finally, through their nuisance powers, cities can make permission to operate contingent on the absence of a wide range of nuisance activities, including disturbance of the peace, drug activity, or public drunkenness. The evidence is clear. When cities put these policies into place and make use of them, alcohol consumption can go down, along with alcohol's negative consequences. CityHealth recently released a new report on safer alcohol sales, which you can access at our website at cityhealth.org. The report provides greater specificity and includes a number of city examples on the relationship between alcohol outlet density and violent crime, as well as a collection of specific safer alcohol sales policy options. At CityHealth, we are here to be a resource and would encourage you to take a closer look at our report, our alcohol sales policy criteria, and contact us should you have any questions. And with that, I'm excited to invite our two panelists, Dr. Arxides Barbeau and Dr. David Jernigan, to join us, to turn on their cameras, unmute yourselves, and we're excited to talk more in depth about this policy. Dr. Barbeau is a compassionate, innovative public health champion who has 25 years of experience leading change in major cities and systems. A pediatrician by training, Dr. Barbeau was the chief medical officer for the New York City schools and went on to lead the Baltimore City Health Department. In 2018, Dr. Barbeau became the first Latina to lead the New York City Health Department. She is a fierce advocate for social justice and is currently a senior fellow at the JPB Foundation. Welcome, Dr. Barbeau.
Thank you.
Thank you. Dr. Jernigan is not only my colleague, but also one of the world's foremost experts in alcohol. David is a professor in the Department of Health, Law, Policy, and Management at the Boston University School of Public Health. And he previously directed the Center on Alcohol Marketing and Youth, otherwise known as CAMI, at the Johns Hopkins Bloomberg School of Health. David is also an advisor to the World Health Organization. He's written more than 130 peer-reviewed articles, co-authored 3 books, and contributed 6 chapters to books. Welcome to you both, and thank you for being here today.
Catherine.
So glad to see you both. You know, as I just talk through the findings of the report, safer alcohol sales is a complex set of policies. I'd like to start off with a question for you, Dr. Barbeau. You grappled with the issues of alcohol outlets and violence in both Baltimore and New York. Why did you make alcohol and violence a priority? And what's one thing you know now that you wish you had known then?
Well, Catherine, thank you for that question. And I think it gives us an opportunity to really center this discussion on communities. When I first became commissioner in Baltimore City, we embarked on a series of community engagement meetings whereby we asked residents in various communities around Baltimore to prioritize what their health concerns were. And what we, over the course of several months, what we came up with was that over 50% of the communities in Baltimore prioritized alcohol outlet density as one of their main concerns. And this was independent of whether these communities already had high alcohol outlet density or whether they were adjacent to communities with high alcohol outlet density, meaning that the people that we engaged, everyday Baltimoreans, realized that alcohol outlet density is not just sort of one particular community's issues. It permeates throughout the city and has implications not only for quality of life, but more seriously, violent crime, as you mentioned earlier, even things like life expectancy. So to boil it down, as a new commissioner in Baltimore City, I listened to the residents of Baltimore And they set us on a course to say, this is what matters most to us. It's an issue that's been longstanding. And I think through the conversation that we'll have through the course of this panel, we'll kind of unfold how we were able to use zoning as really a very powerful measure to reduce density.
That's fantastic, Barbara. Thank you. And as a resident of Baltimore, I completely agree with you. This is an issue that spans all of our neighborhoods and impacts all residents of a city. So I'm excited to talk more about that with you all. David, you've been at the forefront of safer alcohol sales research and advocacy for more than 30 years. What's something that has surprised you during your work in this policy area? And why is there urgency in this moment to take action?
So it's really two of the same things. I am constantly surprised by the invisibility of these problems. We get scattershot news reports, and sometimes they're news reports on, alcohol sales continue to be up. CNN just recently, March 2021 versus March 2019, wine and beer sales up between 20 and 30%. And we also get reports like the recent analysis of hospital admissions data, where alcoholic admissions to hospitals, alcohol-related admissions are up. Alcoholic liver disease, the LA hospitals are reporting increases in alcoholic liver disease. That's a sentinel indicator. It's the canary in the coal mine for the whole range of other alcohol-related problems. And yet in our news media environment, these get reported as snapshots, not as a landscape. It's particularly critical in this COVID moment, when sales are up, when problems are up, that the role that alcohol is playing not be invisible.
That's a great point, David, particularly because you're making a distinction between individual level behavior and kind of these systemic issues that we see that are giving rise to this. Dr. Barbeau, I want to go back to that conversation we started earlier about authentic community engagement, because we know that local leaders have tremendous convening power to hold community conversations about how neighborhoods are developed and shaped. How can conversations about safer alcohol sales give greater voice to low-income communities and communities of color?
I think the most important approach is not focusing just on leaders of organizations that represent communities, but actually going deeper and having those leaders engage everyday residents. Because what we found in our process was that oftentimes the richness of the conversations with everyday residents helped to inform the strategy, the tactics that could be most powerful in our communities. And so I think without that richness, we lose the opportunity of really tapping into the creativity of residents that are living through these issues every day.
I love that example, particularly because it gives a human face to this massive issue that can often feel hard to even begin to address. But you're absolutely right. When you talk to folks on the ground who have to live in neighborhoods that have very high crime rates, what is it they want to see? I think it's a really powerful example.
And Catherine, just to kind of build on that, because you remind me, as we were going through this process of redoing the zoning code, modernizing the zoning code in collaboration with the planning department in Baltimore City, we engaged a community-based organization that engaged youth. And to this day, I don't know how many years later, I still have in my mind teenagers who would get up to speak in front of the planning council and talk about the degree to which young girls walking to school every day had to walk by these alcohol outlets and be harassed, how young teenage men recounted losing friends to violence because of the density that they had in their communities. And so it goes beyond, I think, what we typically think of in terms of individual behaviors, but really it extends into the vibrancy of communities.
I really appreciate your inclusion of the youth voice as well, particularly in this issue area where we focus on the harms of underage drinking, but what about the societal impact as well? That's incredibly important. David, in the report, we show examples from 7 cities. In Atlanta, for example, studies have pointed to a clear connection between limiting alcohol outlet density and a reduction in violent crime. Why does Atlanta stand out as a policy success, and what can other cities learn from what they did?
Well, the most outstanding thing of the Atlanta example is that there was a team from CDC who evaluated it. So it was set up as a natural experiment. It's one of the strongest pieces of evidence that we have that you can improve the situation. We have lots of evidence that the situation gets worse the more the density grows. We have much less evidence that it gets better when you reduce the density, simply because the studies haven't been done. And I'm a researcher, so I'm going to say do more research, but it would be helpful to have more of these studies. At the same time, Atlanta is a really great example of a city that chose to use the power that it has. And it's an educational process sometimes with cities around what these powers are, where they reside. A lot of local communities look at their state law and it looks like they're completely preempted by the state because the state has exclusive control over licensing. But there are other avenues that cities have gone through, including existing nuisance laws. Lots of cities have nuisance laws, existing zoning laws, because cities often control the land, the use of the land that the outlet is on. No matter what that land is being used for, if a city decides that that use is inappropriate or is abusing the privilege the city has given them to use the land, they can take action against a business, any business, not just alcohol. So this whole field really opened up in California in the early 1980s when a city planner who was working on alcohol issues started opening up the whole world of zoning for us. Oakland was sort of the poster child city, but since it's traveled to literally dozens of cities throughout California. They've used it in Omaha, Nebraska. They're exploring it in various other places around the country. And this is a classic example of if the people speak, the leaders will follow. It's exactly what Dr. Barbeau was saying. Community input here is absolutely critical. Otherwise, the processes for governing the role that these outlets play in our communities are dominated by the people who make money from the outlets. It becomes an arcane process dominated by high-priced lawyers hired by alcohol businesses. And so part of our highlighting this policy at CityHealth is A, this is really important to community health, and B, it needs to be much more of a community-driven and community-based policy discussion.
David, I'm just reflecting on my own learning journey of really figuring out what safer alcohol sales were. What were we advocating for? What were we encouraging cities to do? And I think you used a really interesting term, arcane. This is complicated. What would you say would be the first step either an interested community member or a local advocate should take in order to even begin exploring this area?
Sure. I mean, the first step is to collect whatever data you have in your local community around the nature of the problem. And this can involve going to the police. This can involve, in a number of cases, again, I teach in a school of public health. We have master's students. They need projects. Spatial mapping is the cool thing right now in public health. To work with a local school of public health and find a master's student who's willing to learn spatial mapping by doing the kind of analysis that we do on the maps that were on a couple of the slides. It's a graphic way of demonstrating the problem. From there, you go to city leaders, you try to find someone who's willing to pick up this issue. One of the first stops will be to the city attorney, and city attorneys, in my experience, are paid to say no. Do not be deterred, okay? Do not be deterred if that's the first answer you get from your city attorney, which is we can't do this. Fortunately, the Centers for Disease Control and Prevention has identified this area as one of the priority areas, an effective strategy for reducing excessive alcohol use. And so there's a group in California called Change Lab Solutions that has legal capacity to help communities make their way through what can be sometimes a challenging wicket of the legality of what can be done. Change Lab has some off-the-shelf things that they've put together, a very long, frequently asked questions about alcohol outlet density that I helped write, but they also have lawyers who have experience in this, at least one of whom I think is attending this webinar. We love the lawyers in moments like this, but again, do not be deterred by people telling you this can't be done.
I appreciate, sorry, Dr. Barbeau, please go ahead.
To build on what David just said, I think certainly finding a city lawyer who gets the issue and applies creativity. And, you know, in Baltimore City, we were very fortunate to have a law department that was open to creative ways of reducing alcohol outlet density. And I think that really made a difference. It was an equal partnership, I would say, between the planning department, the law department, the health department, and community. And so it really, I think, was an example of how in making these changes, we need a broader approach that draws on the expertise and the value of each of the disciplines. And then just one last thing is I have to sort of just put in a plug for Change Lab Solutions. I am biased, I'm on their board, but I couldn't agree more with David. They have outstanding materials that can help jurisdictions through, you know, A to Z on how to get this done.
Great.
And we're going to keep hitting on high points here in that Dr. Barbeau's comment about the power of the youth testimony. Again, having young people engaged to talk about what this issue is like in their communities, that's something that the data are never going to tell you. And then the other point that I wanted to make was that it's critical. I know a lot of people in this webinar are from my beloved field, the folks who are doing the hard work at the street level around alcohol policies. This is so much bigger than our relatively small field. And this is where we really do have to build out to larger coalitions, whether they're coalitions working more generally on health. In the COVID situation, domestic violence groups. I mean, this is a kind of a no-brainer for us to be reaching out there. Dr. Barbeau talked about how many places it touches in a city, just in city government, the corresponding advocacy groups. You know, one of the groups that was active in Baltimore was the Citizens Planning and Housing Association, because again, this is such an important neighborhood issue. So being able to frame the issue as bigger than alcohol, as about community control, about local small d democracy, about community voices, about equity, about centering the voices of historically marginalized and discriminated against communities. I'm so grateful for the multiple researchers at this point that have traced the lines back to the residential redlining laws from practices from the 1930s and shown this is still showing up. This is still affecting our communities. And I love how Dr. Barbeau framed the issue when she was in Baltimore. She talked about right sizing.
Mhm.
the number of outlets in our communities. This is not an anti-alcohol campaign. This is not
Right.
something against alcohol business, but there are real serious community harms that happen when alcohol outlets are oversized. And we're talking
Mm.
about right sizing things here.
Mm. I can't even express like how much that resonates with me, and I'm sure for many members and participants on this webinar. Dr. Barbeau, I did want to ask you a question about your time as New York City Health Commissioner. You were Health Commissioner when COVID first began to spread in the region, and we know that alcohol sales during this time were spiking as cities went into lockdown. What was on your mind then? And were you concerned by a potential increase in violence? And what advice do you have for public health leaders facing these dual challenges?
Yeah, absolutely. We were concerned about increase in violence. The reality is that in New York City, when we went into lockdown, people actually, for the most part, stayed home. And so it was concerns about violence in the home, as David alluded to, domestic violence, child abuse. So all of these were absolutely top of mind. And working with our sister agencies that oversaw these areas, along with community-based organizations, to make sure that in spite of, being the epicenter of the pandemic in the early period, that we as a city provided supports and services through our partners to individuals in need, because there was no doubt in our minds that this was an issue, A, that was not going away, and B, that was probably going to be aggravated by the stress of the situation, as well as the fact that alcohol outlets remained essential businesses during this time. It's sort of it's sort of a perversity of where we are, right? The fact that people who have longstanding issues with alcohol, if they stop drinking sort of cold turkey, they are at risk for death. And we certainly don't want to have that. But at the same time, I think in retrospect, across the country, and David could speak more to this, I think there could have been, should have been, still needs to be a more surgical look at how it is that we maintain this access without having it be, alcohol outlets being open to the extent that they are, and having other businesses in communities not have that same ability to do their business. And so I think in retrospect, that will be one of the things that comes out, as we say in public health speak, in the hot wash, about how it was that we chose to maintain these outlets open.
That's such a nuanced and absolutely helpful answer in terms of painting this whole myriad of effects that we were seeing in the moment of crisis. David, I'm curious if you'd like to comment at all about, you mentioned earlier some of the news that's coming out right now about the increase in alcohol abuse during that time and some of the impacts that is having right now. I'd love to hear your thoughts on that.
Yeah, I mean, these studies, there's a new one every week or two, trying to stay on top of it. One of the things that's interesting is people's drinking patterns have changed during COVID. And this is important because we know in the alcohol problems research field, how people drink has a really important effect on the kinds of problems that people have. So one of the things that has happened is people are buying off premise, they're getting home delivery, they're buying online more. When they do that, they sit at their computer and they maximize. So they're buying cheaper. They're buying more in larger quantities. And alcohol, it's like you bake a batch of brownies at home and you are going to eat that batch. Well, if you buy a gallon container of vodka, you are going to drink that more quickly than if you're buying smaller amounts, more in, spaced out over time. The other issue we're having is ID checks. With the rise of home delivery, carry out cocktails, all that, the question is, how much easier is this making it for young people to get the alcohol? And this is a real concern because there's a window of vulnerability for one of the serious consequences of alcohol use, which is alcohol dependence syndrome. And that window of vulnerability is basically between the ages of 18 and 25. Lots of reasons for this: brain chemistry, brain development, etc. But there's good reason we set 21 as the drinking age, and yet home delivery is undercutting this. This is just another example of an outlet practice that cities could take greater control over, that city inspections could do something about. It's also something I've talked to multiple local coalitions about simply doing a mystery shopper exercise and publicizing that, because again, this stuff goes invisible so rapidly. And part of what's happening under COVID with alcohol is alcohol is getting treated more and more like broccoli. And alcohol isn't broccoli. Alcohol isn't a normal consumer product. I don't know anybody who's ever gotten addicted to broccoli or been in a broccoli-related motor vehicle crash. And yet, when we start undoing the careful ways that alcohol is regulated in this country, we set the stage systemically for higher levels of alcohol problems.
I just want to acknowledge that we have a lot of questions in the chat box. So I'm going to try to take a few of these. So I'm just going to read them off so we're all on the same page. Acknowledging the importance of this community/city proactive approach. What can states, national governments do to promote the conditions for this to be replicated in other cities? So I guess raising it up to the level of both state jurisdiction or potential national policies. Also, how can media help to avoid the invisibility of this issue?
So go ahead, Dr. Bravo.
No, actually, why don't you go first, and then I'll just give a
Let me do the media piece real quickly. I did a presentation a number of years ago at a panel headed by the woman who had been the chief science correspondent for National Public Radio. And I had 15 minutes and I just went through story after story that was alcohol related, where the news media never mentioned the alcohol connection. And she came up to me afterwards and she said, I am gobsmacked. In 30 years as a journalist, it just never occurred to me. Well, that's a problem. And as community groups, we often have the data. We have the ability to write letters to the editor. If you write a letter to the editor about an individual reporter's story, they will pay attention to it. They do not like to be corrected in their work. So that's the journalist piece. And Catherine, I've forgotten the other half of your question.
So really thinking about
state levels.
The state
level.
Yes, exactly.
So there's a nice map on the CAMI.org website that lays out in fairly rough terms the levels of preemption, the degree to which local communities in different states do have direct power over licensing, at least. That map doesn't do as great a job, though, going into the zoning and the nuisance options that are available to communities. But what we find and what could be best to happen at the state level is, again, to promote local control, local input into the process, local voices. This was seen as one of the lessons of prohibition. The national prohibition experiment in this country was that alcohol control needs to be tailored to the population that is most likely to be affected. And unfortunately in this country, as the companies have gotten larger and larger, the ability of local voices to be in this conversation. It's gotten harder and harder.
And that's where I was sort of going to come in response to your question, Catherine. I am not aware of any states that have taken it upon themselves to give cities more control without being pushed by local jurisdictions. And so I think the experience is more, again, this notion of innovation and responsiveness to local issues happening at the city level, and then in coordination with other groups in different parts of states, then applying that pressure at the state level to get some of that control. And so I think it's a huge issue that, as David alluded to, it's with the issue of preemption, it's easier for the alcohol industry to focus their lobby efforts on the state. And so there's sort of inertia there, if you will, or whatever the right physics term is, to make sure that that structure remains. And really, I think it's the importance of drawing on community and local experience to put that pressure at the state level is critical. And, you know, one of the things, for example, that we haven't talked about and that lies at the state is that the power of taxing alcohol, right? In states like New York, alcohol hasn't been increased in like at least 30 years. And so the power of communities to come together and put that pressure on the state, I think, is something that we shouldn't lose sight of. I think we're rightfully focusing on what's within local control, zoning certainly being one of the most powerful, but also the voices and the political power of communities to push on the states in order to increase local taxes on alcohol, I think is important.
That's such an important point, because one of the effects of increased alcohol outlet density is actually to drive the price of alcohol down, because there are more outlets in a single community, so they're competing for business. So the state level counter to that, one of the best state level counter, is using what one colleague of mine refers to as a poorly performing revenue source, which are the alcohol taxes.
Mm-hmm, mm-hmm. I think that's a great point. You actually are both bringing up topics that our attendees are also asking about. So we did have one attendee who asks, for states that have local preemption per state statute, what are your recommendations for local policy strategies to mitigate alcohol density and harms related to off and on-premise retailers? And this attendee is saying they're specifically in Washington state.
Yeah. And so again, I haven't done this specifically in Washington state, but that is an ideal question to pose to the folks at ChangeLab, because they have the lawyers on staff who know this stuff backwards and forwards and can help you wend your way through those state level policy options. What I would say is absolutely do not give up. Where there's a will, there is often a way here. But my experience working on this issue is community folks are so often discouraged at the get-go by the city attorney, or they go to the licensing board, and the licensing board is classically what political scientists call a captive regulatory agency. They may be good people, but they hear primarily from the industry, they hear from the industry lawyers, and those are the folks that know the process the best. We're playing catch up in public health. But again, I think it's really hopeful to me that an organization like CityHealth would be taking this on as part of the package. I've been some of those deliberations. You know, we came to this because of its role in violence. And we've looked at so many other things that cities could do. We commissioned one of the nation's foremost experts on gun policy to write us a brief about gun policy at the city level. And he came back with two messages. One, almost everything cities can do, they've done, and the rest is preempted at the state level. But two, what isn't preempted is dealing with alcohol, that the relationship between alcohol use and guns and gun-related violence is so close that we can chip away at that by taking action in this arena.
I have another.
If I,
Oh, I'm sorry, Dr. Burpo.
sorry, I'm just going to build on something that David said, and I don't know if this is a question that the audience has asked, but it's certainly something that I've been asked in the past about how we were successful in Baltimore getting this done. And so we've talked about the partnership between community and city agencies, but it went beyond that. So David sort of prompted me on this, and it's, you know, being at the community level, engaging foundations to underwrite academic reports that make the issue more visible and more relatable at the local level, right? That's really critical, is making it personal to that jurisdiction. So it's partnering with foundations, getting support for there to be an academic analysis of what's happening at the local level, and then also encouraging foundations to support community organizing around this, right? Because some of these organizations that we were able to leverage were trusted voices in community, but didn't necessarily have the resources to do the kind of organizing that needed to happen in a short amount of time. And what that then resulted in was having a white paper that was done by David and his colleagues, along with really packing these zoning meetings that, you know, historically maybe had 4 people attending them and 3 of them were on the panel, packed with youth, was really something that just couldn't be ignored.
I so appreciate that addition, Dr. Barbeau, just because I do think foundations are really interested in thinking about ways to make research impactful and to also support capacity building within a community, and what an ideal way to do that, to contextualize the issue within a city specifically. I have a very similar question from Carrie McKee. And she's asking, where do you find this data for an individual community? This data is needed to motivate community leaders, but the data is not easily accessible. Community is in denial about alcohol as a problem. It would be helpful if you could provide data points of collection.
So if you go to that report that CityHealth did, there is something of a methodological appendix there of where we got the data. We actually mapped multiple cities, and the first place we went was the police department. It's knowing which crimes to ask for, and it's knowing the hours and days of the week when they're most likely to be alcohol related. That then enables you to start build a data set of these are the crimes that are most likely connected to alcohol use, and then start mapping the outlets. The outlet data that is public, that should be at whatever licensing agency you have. There are also some national data sets about the outlets, but a lot of this is available locally. It's really having the shoe leather to get out there and get it, because it's not neatly collected in one place. We have another article we did where we estimated the cost of alcohol to the city of Baltimore in 2016, I think, and we published that. We can send that around to people because that shows you, again, the broad array of data that we were able to get and then come up with a credible cost estimate. And this relates to another one of the questions coming in of what do you do when cities want more businesses that they can tax, when they want this as a revenue issue? We have to be able to show them the cost side. Looking to more alcohol sales to get more revenue is borrowing from Peter and ending up paying Paul and Paul's mother and Paul's daughter and Paul's, et cetera. The ancillary costs of that increased alcohol business will severely tax the city.
Absolutely. I just have to say, Dr. Barbeau, Dr. Jernigan, thank you so much for a rich, wide-ranging conversation. Your personal experience and deep knowledge in this area is a tremendous asset. I also have to say it's really helpful to hear about what this looks like on the ground, and how a small but mighty persistent group might actually make inroads in this incredibly important space. So thank you very much for participating today.
My pleasure.
Yeah, thank you.
If you are interested in learning more and potentially reading the full report by CityHealth, my colleague is going to drop the link to the report in the chat. Also, if you're interested in working on this policy, let us know. info@cityhealth.org is the way to connect with us. We provide technical assistance on a number of different policies, including safer alcohol sales. We would love to connect with you. I'm also going to reemphasize something that David said earlier. If you are interested in this area, start talking with your local elected officials. Most local action on this issue comes from a committed group of individuals who are passionate and, as David mentioned, very persistent and refuse to take no for an answer. Thank you for tuning in today. Stay safe and please stay connected via our social channels, Twitter, LinkedIn, and our website, cityhealth.org. Thank you again and have a great rest of your day.
Great. Thanks a lot for having us.
Thanks, guys.